Hi everyone, I'm Dr. Roman and I'm a medical oncologist, and today we're going to discuss genetic cancer testing. So if you're watching this video, there's a chance that maybe you have a family history or a strong family history of cancer, or maybe you have or had cancer, and these are all very valid reasons to get tested. But there are pros and cons to getting tested, and that's what I want to discuss on today's video. So the first question you should ask is, should you get tested? And in general, if you have a strong family history of cancer, especially in first-degree relatives, especially if you have multiple first-degree relatives, then absolutely you should get tested. The other one would be maybe you have a history of cancer or you have cancer. These are also very valid reasons to get tested. But I want you to know that there are, in my opinion, two potential cons to getting tested. The majority are pro, but there are two potential cons. Number one is the cost. Sometimes insurances do not cover these tests, so be prepared to possibly pay to have this test done. And number two is anxiety. What do I mean by this? A lot of times I've seen patients get tested, and to their surprise, an abnormal result comes back. And now they're living in fear, living with anxiety. So if you get tested, be prepared for the possibility of an abnormal result. I think you should get tested because knowledge is power, and if an abnormal test result is found, then we can take proactive steps to try to prevent you from developing cancer. Now we're going to talk about the different types of mutation. So there are two basic types. The first one is germline. This is a hereditary mutation. So you acquired a mutation that you were born with from one of your two parents, which may increase your risk of cancer. And that's right, you can pass this type of mutation on to your children. The other type is somatic. This is not hereditary. You did not get this mutation from one of your parents, and you cannot pass this on to your children. The main cause of a somatic or acquired mutation is, for example, older age, or maybe you were a heavy drinker or you were a smoker, and this caused the mutation later on in life, which increased or can increase your cancer risk. All right, now let's talk about results. So we'll first go over germline. So again, hereditary mutation. So chances are the result will come back normal, meaning negative. They did not find the mutation. Now, there is a chance that it could come back positive, meaning they did find a mutation. And this will come with one of 5 possible results. The first one being pathogenic. Yes, we found a mutation that definitely increases your risk of cancer. The other one is likely pathogenic. We found a mutation that most likely increases your risk of cancer. The other possible result is a VUS, or a variant of unknown significance, meaning we do not know if it does or it does not increase your cancer risk. This brings a lot of anxiety because now we found a mutation and we don't know what to do with it because there really is nothing to do for this mutation. The other one is likely benign. The mutation that we found most likely does not cause cancer. Or last but not least, benign, meaning the mutation that we found does not increase your cancer risk. Now, somatic, meaning the acquired mutation that you were not born with, that you acquired either because you were a smoker, drinker, advanced age, whatever the case may be. The good thing about this is that we might find a mutation that we have treatment options for. So we have targeted therapies, we have immunotherapy, we can predict if immunotherapy will work in your specific cancer. So again, this is for patients who have cancer or had cancer, and we want to try to find a potential target to be able to treat. Now moving on to treatment options. So let's say we did find a germline mutation. Now we can take steps to try to prevent you from developing cancer. As an example, let's say you have a BRCA gene or a BRCA gene. This is one of the more common genes, and it's been, as an example, found to increase your risk of breast cancer. So now we can send this patient, have their breast removed, a bilateral prophylactic mastectomy, and this way try to prevent this patient from developing breast cancer in the future. Now, depending on the mutation that you have, a lot of times we can predict what cancer types are you at risk for, and we can take preventive measures, for example, surgery, to try to make sure that you do not develop cancer in the first place. The other one is active treatment. As I already mentioned, this is more for somatic mutations, but also in germline. If you have cancer or you had cancer, there are treatment options that might work on the specific mutation you have. So that's why it's very important that if you had cancer or had cancer, that you have these tests done. Although we don't do them for all cancer types, but for a lot of them we do, because the more information we have, the better we can treat you, and we can find other potential options that might work on your specific case. All right, we're done. So I hope you find this useful. If you did, please consider subscribing, and I'll see you in the next video.